that still blows me away, that like releasing around the temporal bone and just this little bit of balancing work on the family. And like this family avoids antibiotics, and the work is just so powerful. And I just wish more people knew about it instead of giving up on breastfeeding or going right to medications. Like, work with the body.
Welcome to Keep It Simple Sexy, where I make wellness advice, well, simple. I'm Christine Bullock, fitness trainer, founder of KO Body Care, and mom of 3 little girls. Welcome to my inner circle of elite experts, doctors, and naturopaths who share actionable steps that you can implement immediately into your life to improve your well-being. This is the Keep It Simple Sexy podcast. This episode is brought to you by KO Body Care, the leader in face-grade body care and supplements for total body wellness. Welcome back to Keep It Simple Sexy. I am so excited for our next guest. She is going to share about a therapy. And you guys know I've tried a lot of things in my years, and I've never heard of this type of therapy. And I met her when I was at my breaking point with our 3rd daughter, Josie. She was born colic, which is just a very general term to explain a baby in discomfort and typically crying all the time. And I'm sorry for the ladies that have gone through this or are going through it or know somebody that is going through it. Well, my friend reached out to me and she recommended Craniosacral Fascial Therapy from expert Lauren Brim. And she was like an angel from the moment she entered our house. Well, I had no idea what the issue was with Josephine as of yet, but I had heard that the craniosacral therapy had worked for my friend to help her daughter with colic. And so I was like in for trying anything to help my poor little baby. And doing some research, I learned it's a gentle massage therapy that uses a light touch and stretch techniques to assess and release restrictions of the connective tissues throughout the whole body. This gentle massage of the craniosacral system can help to relax and release tension that is causing pain. It helps gain alignment of the body structurally, and it gets all the systems working, like eating, pooping, sleeping, and basically normalizing the baby's central nervous system. This helps restore a calm and balance to the natural biorhythms of the child. Well, not only did Lauren provide immediate relief, like Josie immediately went to the bathroom like within seconds of her touching her, but she was also the calmest I have ever seen her after the session. So Lauren definitely has the magical touch. And I think whether you are dealing with a colic baby or you are personally in need of relief, so this is for adults too, and interested in hearing about the benefits of this therapy for yourself, Lauren's the expert practitioner to spill all the info. Dr. Lauren Brim is the creator of Bodywork for Babies International. She's a craniosacral fascial therapist, an advanced body talk practitioner instructor, and she runs a busy practice of treating babies and working with families in Los Angeles while teaching this work to others in her online course. She loves sharing this gentle work with our youngest population and watching the miracles that unfold with feeding, breathing, and development, and how this early intervention helps not only the baby, but the whole family thrive. And it absolutely does. Welcome to the show, Lauren.
Thank you. Thank you for having me.
Yes. Well, I'm so excited. I can't wait to have you over again to see Josie as well.
Yeah.
But it's wonderful to just share your talent with the world here on our podcast, because yes, I mean, now having a colic baby, my other 2 were not like this. I just feel for the women that are going through this and like the amount of DMs I got of people that just dealt with it for 10 months, right? And really never found relief or kind of search for it. I think that this is such a great first starting point to then find what the underlying issues are, because if there's something going on that's causing that, I don't want to say anxiety in a baby, but like the tension and the imbalance in it. But it's also for adults. Lauren did a treatment on me too, because like I'm there tense, holding the baby, worried about the baby, and we share that energy. And so it's for adults as well. So please take these tidbits today, and somebody can be doing this for themselves as well. So tell me, what is craniosacral fascial therapy?
Yeah, so it's a therapy that addresses the fascia of the body. And the fascia is the connective tissue. It's a 3-dimensional web that encases our body and goes through our body. It actually makes contact with every single cell of every single piece of tissue. So
Wow.
it's really incredible. So you can work with the fascia of the head, and you can be helping to balance the cranial bones, helping to balance circulation and the actual brain tissue. You can be working with the fascia of the face and working on the sinuses and helping to open up the palate and changing breathing and tongue function. And the whole body is impacted by the fascia. The fascia is composed of collagen, elastin, and ground substance. So it gives us our strength to resist things. It gives us our flexibility and our fluidity, and it plays a huge role in immunity and in communication between the cells. So if we want a healthy functioning body and healthy digestion and healthy brain function, we have to address the fascia.
I mean, I want you to come over and give me a session right now. No,
Yes.
but it's true. It's funny because even in, to relate this to something that maybe people can compare it to and understand is that, like, through my injuries, many times when you have a tight muscle that tightens up, the fascia tightens up around it, we can release the muscle through soft tissue massage, like a deep tissue massage.
Mm-hmm.
But the fascia doesn't necessarily release through that if it's been, kind of damaged in that way. And so our body continues to tighten up if we're not hydrating properly throughout the years, and we continue to dehydrate. Like my job was like, fitness all the time, inflammation, it all breaks it down. And that's what sometimes we're feeling as these imbalances through our body, and drinking, toxicity, whatever, wherever you're getting those toxins, it really holds on to that, affecting your immune system too. So how then can how do you treat that? What
Yeah.
do you
So,
see?
yeah,
What do you see first? What do people see when
when their fascia is injured.
balanced? Yeah.
Or when they get balanced. Yeah. So
Mhm.
fascia, it can be very easily injured, as you said,
Mhm.
dehydration, inflammation, physical stress and strain. So in a baby, how they're positioned at the end of in utero, how they're born, things they go through in the postpartum period, all of that can create tension in the fascia. And then as we go through life, our injuries, our infections, all of that can create this. But fascia is really amazing tissue because it responds to very gentle touch. And
Hmm.
this research was done in addition to with touch, also with acupuncture needles. So when the needle goes into the fascia, or when the hand sinks into the fascia, and it essentially wakes it up. So it follows the way it's pulling, it wakes it up. And then under a microscope, what happens are the cells of the fascia, called fibroblasts, they expand really wide and they wake up and they start reevaluating their environment and changing the collagen elastin ratio and laying down collagen in a more organized way. When the body's in stress, it lays down collagen very haphazardly to quickly protect itself. When it's reevaluating, it lays everything down in a beautiful parallel form. And so we get that healthy tissue that blood circulates to, and lymph and toxins can drain from. And so it's really just very gentle touch, where instead of stretching the body or forcing it in a way, we're following its movement. And this is why it's so great for babies, because it's so gentle. And obviously you don't want anything but the most gentle thing on your newborn or your child. But also it's amazing that the body doesn't need all that force to heal itself. And we're not actually healing the body, we're supporting the body to heal and rebalance and restructure itself.
I love that, because it's funny you say that. It's like such a soft, mobile touch. And I remember when I had some really tight fascia, they were doing like scraping on me, and it was so painful. And now I'm like, wait, I just
Mhm.
want to do the soft, easy one instead. But when we're really speaking about babies, to go back to babies specifically, obviously you want the softest touch for your baby, right? You want them to be in full comfort. But I want to go backwards just a little bit more, because you touched upon it. What are the underlying causes that you normally see where babies will need cranial sacral work? And maybe colicky, maybe they're not even colicky, but there were still some causes beforehand that have caused imbalances early
Yeah,
on.
so some of the big ones are if it's the woman's first baby. So we always think that the uterus just effortlessly expands and gives baby all this space, but our uterus is actually running into our own tension around our organs in our fascia, and the baby doesn't have as much room as we think they have. It gets very, very tight in there. So that's kind of the first thing. And first babies often are tighter. They have tighter heads, tighter bodies, and they cry more. another thing that can happen, and this is more common with second or third babies that are born very quickly, is that a very quick descent through second stage is actually very difficult on the head and brain. So in second stage of labor, the cranial bones fold over, the facial bones are all flattened very dramatically. And if this is kind of a slow pushing out process, then it's easier on the brain and the bones, and then they can open back up as the baby latches and recovers. If it's a very quick second stage, it's almost like a concussion on the brain.
Oh
And
my
I see
God.
those babies really struggle to eat. I've seen it for years, and I was brought up that and educated that, oh, the long labors are really difficult on the baby. But what I've found is that the really fast labors make it really difficult for breastfeeding. And moms are like, I breastfed my first baby, like this baby, the latch is painful, and it's because, and you can even see like the babies have a wrinkle across the
Mine did. Yeah, Josie did.
they come through really, really fast. So that can be really hard on a baby. And then, any stress in the environment, they're little sponges. They're picking it up constantly. And the way that we learn about life is through mirroring and mirror neurons. And, that's why they said during the pandemic, there are so many speech delays in those children that were supposed to be learning speech from watching mouths. And because we were masked, they weren't looking at mouths moving. And so, babies are doing this at an unconscious level from the very beginning. And so if mom's holding stress when she's breastfeeding, if she still has stress in her body from birth, then the baby is also going to show this stress in their nervous system. And so this body work helps to get the nervous system to release the stress, move back into parasympathetic. And ideally, I like to do the craniosacral fascial on mom as well, so that both of them can downregulate and we get the best function of the nervous system.
The Keep It Simple Sexy podcast is brought to you by KO Body Care. Do you feel like it's busy season all the time? Stress affects our bodies more than we realize. High cortisol levels can lead to fatigue, weight gain, hair loss, fertility issues, and more. Combat those negative effects and really feel a difference with KO Stress Support Supplements. These all-natural capsules contain a powerful blend of adaptogenic herbs that help your body to adapt to stress and reduce cortisol levels, the hormone responsible for stress. With daily use, you'll start to notice a decrease in stress and anxiety, improved moods, and better sleep. Say goodbye to the endless cycle of stress and anxiety and hello to a true relaxation and peace of mind. Order now and receive a 20% discount using code KISS20. That's code KISS20 at kobodycare.com. Stress support adaptogen capsules are my not-so-secret way to handle it all. And even when we weren't doing like a full session on me, I was like breastfeeding while you were treating the baby and you were like relaxing my shoulders, taking a breath, exactly putting yourself into the right form to be relaxed for the baby. And it's funny, I didn't know about the really quick labor because Josie was like a 1 minute, 1 push labor. She came out and they were actually like, she's flying out, like just stop for a second. Yes. My husband had a football hold. Like, truly, I have a picture of him waiting. I'm like, it's not going to fly like that, honey.
Yeah.
But also, she sat low for a long time. I had Braxton Hicks for 3 months. And I was like thinking, this has to be stressful on this poor little baby. And she has to be. And it was like, so it ended up, at least for Josie, affecting what you saw right away was that her jaw was recessed. And I don't know how much I want to go into this. But I want to say it because there's so many people, like you saw that her jaw was recessed. Then you noticed that there was probably a tongue tie. And then we noticed in another session, there was probably a lip tie. And you directed me to the right doctors for that. But I think that that's even something that's when you're saying, a stressful environment for them. And maybe when they're kind of packed in there a little bit, we're seeing that more and more, just this tight fascia structure and including the mouth. And for Josie, it ended up being like a posterior, which is even more fascia, really tight. How often do you see this now?
So we're seeing the tight fascia in the mouths. That's resulting in tongue ties and lip ties in so many more babies now than ever before. I was at a conference where there was a pediatrician who's been doing this for 30 years. And she said, what she sees now, like back then when she started, you occasionally see one. And now it's just so common. And the theories around it are that we have these epigenetic markers. So it's not it's not the genes. There is sometimes a genetic component where the parent's tongue-tied and then the baby's tongue-tied, but these epigenetic factors, they come from toxins and trauma. That's how epigenetic markers form. And then they change the formation in utero. So this tongue frenulum, that's very normal. With this epigenetic marker, it forms very rigid and tight. And then the baby's tongue doesn't rest on the roof of the mouth to widen the palate. It's hard to scoop it under the breast or bottle to get the milk. And then, you get a perfect storm when you have a baby who's had either the genetics or the epigenetic markers that the tongue is tied or the lip is tied or the mouth is tight. And then you combine that with sitting low in utero and a fast birth. And like, you've got a recipe for a disaster. That baby's going to have such a tight head, such a tight jaw, and they're not going to be able to downregulate, because when the tongue sits to the roof of the mouth, it stimulates that parasympathetic, the vagus nerve. That's why kids whose tongue doesn't do that, they suck their thumbs, or they want to have things in their mouth. It's how we soothe ourselves. And there's even theories that, as adults, we seek out more self-soothing behaviors, with the mouth to have the same effect, how we try to downregulate ourselves. So
I mean, if you think even gum, smoking, eating, even just things like that, drinking, straws, whatever, like that kind of stuff too. Yeah. That's so interesting. And then Josie, on top of it, had a super high and shallow palate. So it was like even harder for her tongue to go up. And then I even noticed it now on my adopted daughter, that she has a high and shallow palate, and it's affecting her sleeping, which is a whole nother side thing. But it goes to show there are I'm just hearing. I even saw this girl on TikTok recently just talking about now she thought she had like Lyme disease and all of this, and all the symptoms were from having a tongue tie, she finally found out. So adults are now realizing it and having to go in and do all that repair as well. But without going into all that, I mean, because there's so many things a baby can go through. It's just not just tongue ties and lip ties. But what are the benefits that you see from when, I guess, should someone call you? And then what are the benefits?
I mean, I love to see the baby within the first 24 hours of them being born, because we can just resolve those things right away. The cranial bones are still so soft. And I mean, they're soft for a long time, but just day one, I mean, it's the perfect time to get the baby all centered, to get their latch really well so that mom has a good experience of breastfeeding. She has an easier time of her milk coming in. It's just helpful to help baby recover from birth and recover from fetal life. But at any point that we get the baby, we can help the baby to feel better, and we can release tension anywhere in the body. And, sometimes I don't see babies till they're 6 months and not rolling over, or a year old and, not crawling, or 15 months and not walking. So this is also work that we can do to help the baby when they're developmentally delayed and their body's not doing what it's supposed to be doing. We can get in there and resolve, well, okay, they're not walking because there's all this, tension pulling them here, or, they're not sleeping well because the tongue isn't sitting right. And how can we open up the facial bones and the cranial bones and get things positioned right? So at any age, this can be helpful for the baby. I've worked with a lot of children with behavioral issues, and this has been like life-changing, kids that wouldn't go to school, kids that are having night terrors. Like, there's just so much that we can do when we work with the nervous system. Because again, the body's designed to digest trauma and experiences and emotions. And so part of the reason it doesn't is because it's not moving. The brain isn't moving. The diaphragms aren't moving. We actually, our bodies can digest and can function. So if they're not, it's because something is stuck and needs to be released.
And I think too, like, I would say now that I understand the benefits of this, I would do this no matter what after 24 hours for my baby, just to check any kind of alignment and help them in that transition from, through birth and into this whole different environment. Now, I met a woman, she's had 5 kids, and she's like, oh yeah, I get baby chiropractic within the first 24 hours right away, but it's the same thing. And, super soft, fully aligned. So can you walk us through what a session looks like?
Yeah. So I start with the baby's sacrum, which is the bone at the base of the spine in the pelvis. And we can feel by holding that bone whether the body's pulling forward, pulling back, twisting to the side. And we just follow the fascia. So we're just following that movement, bringing in the feet and the legs to feel that everything, anywhere there's pull, we follow that pull. And then when there's no more pull, they just sit right on center. So the pelvis sits on center, the feet are equal tone, the legs, the arms, there's equal range of motion. The tongue sits on the roof of the mouth, all the bones of the face. We make our way through the diaphragm, the torso, the throat. There's often can be a lot of tension in the neck and the throat from being pulled out of the birth canal or pushed or, again, sitting low. The tongue ties, if a baby is tied, there's tension down through the throat into the diaphragm. So we're just making our way all the way up. And then I'm usually finishing with the cranium and then working inside the mouth. And then lastly, kind of additionally with the dural tube. And it takes usually about an hour to get through all these all these areas of the body. And then I'm also working on the baby while they're breast or bottle feeding, which is a really, not something that is typically done, but I found that it's a really helpful way to work because there's that great suction at the breast or bottle. And so you can really manipulate and work with the cranial bones better that way. And you're supporting the mom to sort of restructure her story around breastfeeding and have some more support with that, and to really notice the change in baby's latch and start to have a different experience of it.
Yeah, it's like you're retraining in that moment of what their latch is like too. You really can feel, in that movement what needs to change a bit and help them do that as well. And you really did too, like with us with breastfeeding, and then maybe we were bottle feeding too after a while. When you came, you were the one that pinpointed the space in the air that she had and this and the jaw to help. So I would help to press the jaw and release the jaw more. And then I also noticed like how tight and set back her jaw was after that as well.
Yeah.
And I mean, I will say, so you tell me what I don't want to dive into it myself, but I will say what we saw in Josie specifically, but what can you expect to see after a session with a baby? And it's always different. I'm sure different with each baby, but.
Yeah, I always tell families that I've been doing this 10 years, and within 10 minutes, you should see a difference in the latch. And that's seems like a pretty crazy thing, but that's just how quickly babies release tension and open up. And the latch should be pain-free. They should transfer milk really efficiently. The mouth should be closed when they're at rest. They should be breathing through the nose. The cranium and face and body should be symmetrical. They shouldn't be pulling in one direction, which we label torticollis, or creates plagiocephaly, where there's a flattening of the cranium. And digestion shouldn't be so stressful. I mean, digestion's still a new thing for a baby. They were getting all their nutrients from the umbilical cord, and now they have to digest food for the first time. But it should get better and better, and they should poop regularly, and they shouldn't be, riddled with gas pain. So the body work, in some babies, it's instant. It's really, really fast. And other babies that have been tight for a long time in utero, had complicated births, have tongue ties, they will need more sessions to get to that place. But I just recently treated a 2.5-year-old who had ears full of pus. They were going to do antibiotics, and we did one bodywork session, and I worked on him for 20 minutes because then I worked on his brother, and then I worked on the mom, and the mom took him to the doctor 4 days later, and no more pus in the ears. And she's like, thank you so much. The last time we gave him antibiotics, he had eczema all over his body, and they had to get on an airplane the next day. So she was really desperate to come up with a solution. And even me doing this for 10 years, it still blows me away that like releasing around the temporal bone and just this little bit of balancing work on the family, and like this family avoids antibiotics, and the work is just so powerful. And I just wish more people knew about it instead of giving up on breastfeeding or going right to medications. Like, work with the body, like, why is this missing from American culture? Like, we have the treatment, like, people just need to know about it.
I mean, imagine working with your pediatricians, where they could refer out and help with those kind of things. Like, why don't you try this first? And it's funny because I love our pediatricians, but when I was like, I think we have a tongue tie maybe after the first time I saw you, they're like, no. Like, and it's like a stage 5 posterior tongue tie, which is like the hardest you can have, and a lip tie. Right. So, I love these like natural sources, and having, all those like friends that would even refer me to me, for us to be able to get relief in all of that. So, and I want to say too, with Josie, it was like an immediate relief. I think she was maybe 1.5 months to 2 months when you first came over.
Mm,
So unfortunately, it wasn't like first 24 hours, even the first few weeks or so.
yeah.
But she was having such bad gas. She wasn't going to the bathroom, which I found out later she was having a lot of silent reflux. You were also the person that saw that, probably from the gas, and just crying a whole lot. She was in pain. You could tell.
Mhm.
And it was just like, it broke my heart. And within almost like a minute of you just touching her, she went to the bathroom once on her own. And then after you left, same thing. She was so relaxed. After you left, she went to the bathroom fully. And
Mm,
then she was like putty in my hands. And you could feel the difference of how tense she was all the
yeah.
time to this putty. It was like she was so light suddenly. I mean,
Mhm.
that was for me like the happiest change. And then she ended up just sleeping so well, putting herself to sleep, where we were doing like hard rocks through cries, where you're just like
Yeah.
forcing that baby to sleep. Um, and now it would come back because she did have probably a lot of trauma, in steps for her. And we're still treating her too, but she is just like night and day. And what I love about Lauren too is that, you knew so many amazing experts, and you were the one that were like, I think she has a tongue tie. I don't say diagnose, right? Because
Yeah.
that's not where your
Yeah.
expertise
I
is, but
don't
like, you're like, go try it. Here's an expert to find out if it is tongue tied, then the lip tie, then the silent reflux. Like, you knew it all. So I can't recommend Lauren more for babies and
Thank you.
adults, if you did adults, other than when you're with the families. So how often should someone do this?
I mean, some families do it once a month as just maintenance, and we want to be as well as possible. And they know that tension accumulates again with stress and inflammation and infection. But I also
I
tell
love that.
parents, to do a session and then watch your baby over the next 24, 48 hours. And if the symptoms have resolved, then great. And if there's still some symptoms, then bring them back. So we can kind of just see how the baby does with the session.
And I love that too, because I would want, when you were talking about a child being sick, I was thinking your kids are probably never sick, or even if they get something, you can work through the fascia system and help to boost their immunity, any infections, so with the nasal stuff, all the stuff that the kids get. I would want to do this every month, especially in the sick seasons, where we could prevent a lot of the infections, boost their immunity in a natural way, align them, align their central nervous systems. I know I have a 2-year-old, even a 5-year-old, who get a little lack of sleep or a little over, stimulated. And I think that would really help to balance everything out. Like, we know when we get just normal massages and are taking care of ourselves with self-care, how it helps to prevent full meltdowns, adult meltdowns.
Totally.
And I would want it too. So you're hired. I'm bringing you back every month now for the whole family.
Um,
And the baby too. But I mean, I really love this work and what it can do. So if they're not in the Los Angeles area, what do you recommend to find an expert like yourself?
Yeah, so if your lactation consultant or your midwife doesn't have someone locally that they recommend, I've put together this website, Bodywork for Babies International, and my hope is that we'll keep adding to it so that practitioners that do work with babies, that do craniosacral, that do myofascial work, that do occupational therapy, that we can help parents to find those resources, because right now it's very difficult to find. Like you said, the pediatrician often doesn't have the resources for you. Sometimes your lactation consultant doesn't. I've talked to people that are very trained in craniosacral, and they're like, "Oh no, I don't touch babies. I'm scared to work on babies." I'm like, "Why?" And so, providing this website, my hope is that we will help connect the practitioners with the parents. And then I've also created an online training so that parents themselves can study the work and work on their kids. I've worked on both of my kids, within 24 hours of being born. I just work on them sitting on my couch. So this is really something that anyone can learn as well.
Oh, amazing. I'm going to take that course too.
Cool.
I love that. Yeah. Um, that is an amazing little tidbit for parents to be able to have in their slew of talents for children.
Yes,
you know,
absolutely.
Teaching, cooking, craniosacral fascial therapy.
There
There
you go.
you go.
Gotta do it
Truly,
all.
keep
Yeah.
them calm. Yeah, and boost their immune system at the same time.
Hmm.
Well, thank you, Lauren. This is a wonderful tidbit of information for everybody. I think it's something that I love sharing. I mean, this is like old school, but new information for so many of us to really help heal our kiddos. I mean, that's most important, and also keep your sanity as a parent and keep you healthy too. So we
Yes.
usually end with a speed round question. What is the first thing you do when you wake up?
Drink water and go get the baby.
Preach. No, I love all the Instagrams of like meditation and this and that. If I say one thing of gratitude when I wake up before I'm running to get the baby, I feel like fully accomplished for the day.
Yeah.
Today I did one forward fold because my hamstrings were so tight before grabbing the baby. And I was like, wow, I haven't stretched in I don't know how long. Good for me. What do you do to unwind?
Get a massage or do yoga at home or go for a hike.
Love it. Well, you're the expertise in finding that balance. So I'm going to take that, that knowledge from you. I'm going to try and do those things, add them in as well.
Yeah.
Well, thank you, Lauren. If you guys want to get more information from Lauren, her social handle is Body Work for Babies International. And her website is Body Work for Babies, INT in International as well. Thanks for listening. Make sure you're subscribed and feel free to share this with a friend or family who needs to hear it. Have questions you need answered? Text me at 1-310-361-8697. Make sure you're following me on social at Christine Bullock, and have a healthy, happy week. See you next time.